Hello everyone, I am Dr. Mahalakshmi, educator, forensic medicine and toxicology. So in this video, we are going to see about asphyxia. This is one of the most important university exam topic. And when they start with asphyxia, the most important thing the examiner would ask you is, what is the definition of asphyxia? They will start from the basics. So asphyxia, it literally means pulselessness. So pulselessness is the meaning of the asphyxia. And what exactly they mean by asphyxia is that this is exclusion of air from lungs. So this is what they try to mean by asphyxia. So when there is exclusion of air from lungs, we call it asphyxia. And there are multiple modalities of asphyxia. Means like asphyxia can be caused by lot of things. Here what we are going to mainly see is mechanical asphyxia. So mechanical asphyxia is our forensic topic. Why I am saying mechanical asphyxia is that here the asphyxia is caused by mechanical factors. There will be some mechanical obstruction which excludes air from the lungs. That is what we call it as mechanical asphyxia. Apart from mechanical asphyxia, there are lot other types of asphyxia available in our field. So one such type is pathological asphyxia. So by pathological asphyxia, what we mean is that due to some pathological reason, there will be exclusion of air from the lungs. So what are those pathological reasons that you could think of? Do you know anything? Like this is something very common. Pathological asphyxia because of polio or any other disease which affect the muscle due to muscular weakness. Muscular weakness leading to the obstruction of the respiration. So there will be no muscle movement, there will be no respiration. Because of that, there will not be any air in the lung and you will get asphyxia, that is anoxia, hypoxia because of that mechanical obstruction or pathological obstruction. So this is mainly asphyxia. So one type is pathological asphyxia. Apart from that, you also have this toxic asphyxia. So toxic asphyxia, do you remember any toxic condition that results in asphyxia? One condition that we will be dealing in toxicology. Do you remember anything? Do you have any idea on that? So toxic asphyxia, it is seen with cyanide toxicity. So in cyanide poisoning, there will not be enough activity by the cell. There will be histotoxic activity by the cyanide. So because of the histotoxicity, that is at the cellular level, the uptake of oxygen will be inhibited by the cyanide particles. So these kind of thing, like these toxic particles, they will result in anoxia, hypoxia. That kind of asphyxia we call it as toxic asphyxia. So one toxic asphyxia we have seen is cyanide. There is another toxic gas that can cause asphyxia, that is carbon monoxide. So this carbon monoxide that can also lead to anoxia because of its affinity to the hemoglobin. So that is also coming under toxic asphyxia. Next to that, we have one more asphyxia, that is environmental asphyxia. So environmental asphyxia, here any idea? Like just looking at the term you can guess, right? So environmental means there are some environmental factors which is leading to asphyxia, that is your anoxia. So what is an environmental factor that could possibly lead to asphyxia? So one such factor that we can expect is like sewer gas, that is your hydrogen sulfide, when there is excess of irrespirable gases. So if there is any irrespirable gas available in the environment, like your hydrogen sulfide, there is excess of nitrogen or less amount of oxygen available, those kind of situation. When you go to high altitude, like in the space and all, there will not be enough oxygen, right? There will be lot of irrespirable gases available in there and sometimes there will not be enough gas at all. So those kind of conditions, it will lead to asphyxia. We call them as environmental asphyxia. So these are the general thing that is related to asphyxia. But when we come to the forensic part, what we deal with is mechanical asphyxia. So what do we mean by mechanical asphyxia here? There will be mechanical obstruction. So mechanical obstruction, it can be either hanging, or strangulation or suffocation or postural and traumatic asphyxia. All these factors, they will lead to some sort of mechanical obstruction so that air cannot enter the lung. That is what we are going to mainly see here. So, when we say the classification of asphyxia, you have to say mechanical asphyxia, pathological asphyxia. And if we say what is the classification of mechanical asphyxia, you have to say it is hanging, strangulation, suffocation, postural asphyxia, traumatic asphyxia, and one more thing, that is drowning. So, these are the classification or types of mechanical asphyxia. So, when they simply ask you what are the types of mechanical asphyxia, these things you have to tell them. And if they generally ask you what are the types of asphyxia, you have to tell them like we have mechanical asphyxia, pathological, environmental, all these types you have to tell them. So, this is the broad classification when we start the chapter with. And next to that, what we are going to see is the triad of asphyxia. So, when we say triad of asphyxia, this is mainly a post-mortem feature that we will be seeing in all asphyxial death. All sort of asphyxial death, especially your mechanical asphyxial death. So, what are the mechanical asphyxial death that you can get in forensic setting for autopsy? You commonly get suffocation or hanging or strangulation. So, among these three, which you commonly get, it is your hanging, right? So, hanging and all these other also types you will be getting to see these triad. So, what are the triad features? You can remember it by the term CPC. So, C is for congestion of internal organs. Congestion of internal organs. Then P is for petechiae. Then C is for cyanosis. So, these three is known as the triad of asphyxia, and they will definitely ask you if there is a question regarding asphyxia, mechanical asphyxia, especially in case of Viva, they will definitely ask you what is the triad of asphyxia is. So, triad of asphyxia consists of these three things, CPC, congestion of internal organs, petechiae and cyanosis, which is very, very important to know. So, congestion of internal organs means there will be engorgement of the blood vessels. So, inside the organs, all the blood will be pooling. So, because of that, there will be a violet color or bluish hue. All the organs will look dark, blue color or violet color, it will look very, very dark color. So, that is what we call it as congestion of internal organs. This is especially seen in lungs. Next, what we have is petechiae. So, petechiae is basically a hemorrhage. So, it is a hemorrhagic spot, but it will be like less than 2 millimeter in size. When it is like very, very small, we call it as a petechiae. So, this is your petechiae, which is nothing but a small hemorrhagic spot. Then finally, you have your cyanosis. So, cyanosis is what? Cyanosis is something we commonly seen in lot of patients. So, what is cyanosis? Cyanosis is bluish discoloration. So, your fingernails, you can see the bluish discoloration of your fingernails is cyanosis. And apart from these three, if you want to go a step ahead, there is something known as quintlet of asphyxia. Quintlet of asphyxia. So, what do we mean by quintlet of asphyxia? So, triad means 3, quintlet means 5. There will be 5 features that is seen in this asphyxial death. So, we have already seen these 3, CPC, congestion, petechiae and cyanosis. Apart from that, you get 2 more features. So, first feature is that abnormal fluidity of blood. So, there will be abnormal fluidity of blood. This is the 4th feature, and you have another feature that is engorged or enlarged right side of the heart. So, these features, congestion, petechiae, cyanosis, engorgement of right side of the heart, then abnormal fluidity of the blood. These 5 consist of the quintlet of asphyxia. When they ask you what is the triad, you have to say it is cyanosis, petechiae, then congestion. If they ask you what is the quintlet of asphyxia, you have to say these three. Along with that, you have to add abnormal fluidity of blood and enlarged right side of the heart. So, this is the general things that we have to start with in case of asphyxia chapter. So, now we have seen what is asphyxia, definition we have seen, what is the classification of asphyxia we have seen, and we have seen what is the mechanical asphyxia and what are the types of mechanical asphyxia also we have seen, and we have seen the classical triad that is seen in asphyxia and also the quintlet that is seen in asphyxia. So, with that, now we are going to see about each and every part of asphyxia. So, first we are going to start with hanging. So, first what you have is hanging. So, now like how we gave definition for mechanical asphyxia, there is also a definition for hanging, and that can be asked in Viva. If they want to go a bit further, if they want to give you extra marks, they will ask you this, what is the definition of hanging. So, basically what you have to know is, in case of hanging, what happens is that there will be mechanical asphyxia. So, it is the type of mechanical asphyxia where there will be constriction of neck. So, you have to have a neck constriction, and that constricting force should be body's own weight. So, this constricting force should be body's own weight. So, these three things have to be fulfilled if you want to say something as a hanging. So, it is a mechanical asphyxia that is caused by constriction around the neck, and that constricting force should be body's own weight. If these three things are fulfilled, we call it a case of hanging. So, this is your hanging's definition. If someone asks you what is the definition of hanging, you can definitely say that it is a type of mechanical asphyxia which consists of constriction of neck and constricting force being the body's own weight. If you tell this much, that is enough. So, this is basically the definition of hanging. Why I am saying these three things have to be fulfilled is that you have strangulation up next, right? So, strangulation also, it is a type of mechanical asphyxia. In strangulation also, you will have this constriction of neck. But there what will be absent is that the constricting force. The constricting force will be external. Okay, so the people who is constricting or the object that is constricting would be external. There will not be body's own weight constricting the neck. So, just imagine there is a case of hanging. You will see hanging, right? Like you must have seen some cases of hanging or some pictures of hanging at least. So, what will happen? They will be hanging. There will be a rope around the neck. Like this rope, it will be constricting the neck. And what is the force that is pulling the rope upwards? It is your body's own weight, right? That is the hanging. Now, just imagine a case of strangulation, like somebody is constricting a neck using a wire or something. So, there will be mechanical asphyxia, there will be constriction of neck. But the one thing differing from hanging to this is that the constricting force would be from somebody external. Even if it is something accidental, there will be some external force which will be constricting the neck, not body's own weight. So, the main difference between these two, the strangulation and hanging, is that the body's own weight would be constricting the neck in case of hanging, while in case of strangulation, it will be an external force that will be constricting the neck. Clear? So, this is the main difference between the definition of hanging and strangulation. And next up we have is suffocation. So, here what happens in suffocation is that there will be mechanical asphyxia. So, there will be mechanical asphyxia, but here there will be no neck constriction. There will not be any constriction of neck. That is the main thing that differs between this hanging and strangulation. Suffocation, there will not be any constriction of the neck, but still there will be mechanical asphyxia. So how it can happen? Any idea how it can happen? So neck is free. There is no constriction around the neck. Is there any other way that can be obstructed so that the lung is not getting air? Is there any other way? Yes, right. You can obstruct the nose. You can obstruct the mouth. Or if there is any obstruction of the trachea or any obstruction of the your pharyngeal level, posterior pharyngeal level, oral cavity, if there is any obstruction there, all those things, it can cause exclusion of air from the lungs, right? But still there won't be any obstruction around the neck externally. So that is where this suffocation term comes to. So we have seen what is a hanging, what is a strangulation, and what is a suffocation. So all these three, these are the most commonest thing that we come across, and these are very, very important. Apart from that, you get two other things, that is postural asphyxia and traumatic asphyxia. Now these two may sound similar and may look similar, but the mechanism is kind of different. So here what happens is that in case of traumatic asphyxia, there will be some trauma. Okay, just imagine like someone is going to a very large gathering and there are a lot of crowd and people are getting stampede. Okay, you know stampede, right? If there is lot of crowd, lot of gathering, if there is like unorganized thing going on, people may fall down, somebody may run over them, all those stampede thing will happen, right? Those stampede, how they die is due to this traumatic asphyxia. What happens here is that the chest wall movement, the movement of the chest wall is obstructed externally. So it is obstructed externally due to external force, like something may fall upon them, some people may fall upon your chest wall or some heavy object may fall upon your chest wall. Because of that, your external movement, chest wall movement will be obstructed. So if there is no chest wall movement, there will not be any respiration happening and no air can enter the lungs, right? So this is also a type of mechanical asphyxia where the chest wall movement is obstructed by some external force. This most common example is your stampede. This is your traumatic asphyxia. Now comes the postural asphyxia. So this postural asphyxia, what happens is that here the body, it will take a position so that the external movement is affected, the chest wall movement is affected. Like this is most commonly seen in drunks. So when somebody is they have drunk a lot, if they have drunk a lot of alcohol, what they will do is they will assume a position, very, very unfavorable position. Sometimes they will sleep upside down, like something like that. They will assume some sort of position, like these jackknife positions. All these unfavorable positions people may use, and those positions, what they will do is they will obstruct the chest wall movement. Okay, something internally. So internally it will, chest wall movement will be affected. So when it happens internally, by assuming some unfavorable posture, asphyxia happens. We call it as postural asphyxia. When some external force is preventing the chest wall movement, we call it as traumatic asphyxia. So these are the main types of mechanical asphyxia that we deal in this chapter, and we have this one separate entity, that is drowning. We will see later on. This will also come under mechanical asphyxia, but this is a very broad subject, so we will deal with drowning later on. Now we will just stick on to this hanging, strangulation, suffocation, and these two postural and traumatic asphyxias. So now we are done with the what is the definition and type of the mechanical asphyxia. We are going to see about the types of each and every asphyxia. So first you have the types of hanging. So type of hanging, you have two types. One is your typical and atypical, which is based on the knot position. Based on the position of the knot, you classify hanging into typical hanging and atypical hanging. So what differs between these two is that in case of typical hanging, the knot will be at the level of occiput. So not it will be present over your occiput. If it is present over there, it is a typical hanging. And if it is present anywhere else apart from your occiput, we call it as atypical hanging. So this is the main type of hanging. And up next what we have is another type of hanging, that is complete and incomplete or partial hanging. Complete hanging and incomplete hanging. Here what happens is that this is based on the position of feet. If the feet, it is not touching the ground, that it is above the ground, then we call it as a complete hanging. That will be complete suspension of the body. It will not be touching the ground. Like not just feet, any part of the body, no part of the body will be touching the ground. But in case of incomplete and partial hanging, what will happen is that like some part, especially feet, it will be touching the ground. So these kind of hanging we call it as an incomplete or partial hanging. So types of hanging we have typical and atypical based upon the position of the knot. If it is present over the occiput, it is a typical hanging. If it is present anywhere else apart from occiput, it is atypical hanging. Then based upon the position of the feet or part of the body, we divide them into complete hanging and incomplete or partial hanging. In case of complete hanging, the whole body, it will be above the level of ground and it will not be touching the ground. If it is touching the ground, any part of the body, if it touches the ground, we call it as incomplete or partial hanging. So this is the type of hanging we mainly deal with. Apart from that, we have other types based upon the manner that we will see separately later on. And now we are going to see about the type of strangulation. This type of strangulation, this is very important. In this type of strangulation, what happens is that they will show you a picture, they will put it as a spotter and they will ask you what type is this, what is the name of this type of mechanical asphyxia, they will ask you. So first is this. So here you see there is an iron collar around the neck. See this, there will be an iron collar around the neck and they will tighten the collar using a rod. So like there will be a separate rod which will be used to tighten this iron collar. This type of mechanical asphyxia, it is known as what? This is a very famous type. This is known as garroting. Garroting, also known as Spanish windlass method. So this is a type of strangulation and here what happens is that an iron collar will be put around the neck and that collar will be tightened using another rod. By screwing around the rod, they will tighten that collar. So this is garroting, and this garroting, it was used as a punishment for slaves. Like during this old times when there was slavery, this is how they used to punish the slaves. This is garrote and they may show you the picture as a spotter and they will ask you what type is it. And up next what we have is this. Here if you see, you can see a wooden rod, you can see this wood, right? So here what will happen is that they will use bamboo stick. They will use this bamboo stick to constrict neck. So this is your which type? Bamboo stick using for constriction. This is Bans Dola. This is Bans Dola. So this is the name. Bans Dola. Bamboo stick is used for neck constriction. This is Bans Dola. Then up next, this is very commonly seen, commonly used, very frequently seen in a lot of pop cultures. So, this is mugging. So, here what happens is that the elbow, your cubital fossa, this is used for constriction of the neck. Elbow is used for constricting the neck. This is commonly used by a lot of thieves. They'll, like in the dark alley, they will come and they will mug you and they will take out all your valuable possessions. This is your mugging. And next what we have is this. This is very, very important. What is this? This using hands for neck constriction. This is very, very important type. They will ask you 5 marks in this also. So, this, what is this type? This is your manual strangulation, also known as throttling. So, this is also known as throttling. So, this is very, very important type. So, what they will do? They will use the hand, they will use the palms to constrict the neck. So, this is manual strangulation, otherwise known as throttling. So, these are the types of strangulation. Hanging, you had very simple 2 types, typical, atypical, complete, incomplete. But in case of suffocation, you have all these types, which each and every photo will be asked as a spotter, or it will be given separately as a 2 mark also. So, what is this Ban's Dola? What is garroting? Like that they may ask you. So, these are the types of strangulation. So, these are very important, and this manual strangulation is very, very important. Sometimes they will ask you, what is manual strangulation? What is the other name for throttling? Like that, this other name also they can ask you. So, here they mainly use the hand, the palm. It is used for constriction of the neck. This is your palmar or a manual strangulation. Next, what we have is type of suffocation. So, type of suffocation, the main thing here is smothering. So, smothering is the important type in suffocation. So, here what happens is that there will be obstruction of the orifices. Here they will obstruct the nose or mouth. Your external orifice, it will be obstructed. That we call it as smothering. Then up next what we have is this burking. So, burking, it is a very, very famous name. So, burking also they will ask you, what is a burking? Which subtype it will be coming under? So, what happens is that this burking, these two are known as Burke brothers. So, what the story is that it is an actual historical event. What happened was that, like during ancient times, when like the medical advancement was not that far, what they used to do was, they don't usually get any corpse for doing autopsy or like studying the anatomy. Nothing was available. So, these doctors, what they used to do was, they will pay all the people to give them some dead bodies just to experiment upon. So, they will give a lot of money to people who give them dead bodies. So, these two Burke brothers, what they used to do was, they were giving them dead bodies. But after some time, they couldn't get enough of dead bodies and the demand was so much, so that the lot fee they were offered. So, what happened? These two brothers, they started killing people and then handed over the body to the doctors for these experiments. So, these two, they used a method. What they will do is, they will usually bring some people with any home, like no home, like homeless people, they will bring them to their place and they will feed them lot of food and alcohol. Once they are so inebriated, once they are like so completely done, what they will do is, they will just push them to the ground and one will sit on the top, okay, one will sit on top and the other will close the orifices. So, these two, one will sit over the person and the other, they will close the orifices. So, this is homicidal smothering plus traumatic asphyxia. When they sit over the person, what will happen is that because of this smothering, there will be exclusion of air, right? There will be no entry of air to the lungs. And when there is person sitting over the chest wall movement will also be obstructed. So, because of that there will be asphyxia, and this combination of these two terms, this homicidal smothering and traumatic asphyxia, we call it as Burking because of these Burke brothers. Since they did it to a lot of people, they just sit over the person, they will close the orifice so that they will die, and afterwards they will bring the fresh body to the doctors for experimenting. So, this is how they used to do in the past time. Because of those brothers, we call it as Burking. So, this is the second type of suffocation which is very important. And after that you have this. So, this one, this is gagging. So, this we have seen in a lot of movies. So, what they will do, they will push some cloth or rags, like something, they will push it over the mouth. So, inside the mouth they will push lot of things, and because what happens, how asphyxia happens here is that because this cloth is pushed inside, there will be irritation, right? When something is put inside the mouth, there will be irritation. Because of that, there will be production of the saliva. So, saliva production will be there, and afterwards what happens is that this cloth, this will absorb all this saliva and it will swell. So, swollen cloths. And this cloth, what will happen after once it's swollen is that it will go impinge over the posterior pharyngeal wall. So, once it touches the posterior pharyngeal wall, there will be activation of the vagus nerve. So, this vagus, it will cause reverse inhibition of the heart. Because of that, the patient will die. This is the mechanism behind gagging. So, basically, they will put something, some rag or cloth inside the mouth. This rag, it will cause irritation. Because of that, there will be increased salivary production, which will swellen up the cloth further, which will go in turn and impinge over the posterior pharyngeal wall, activating the vagal reflex. So, vagal reflex will result in the inhibition of the heart. So, this vagal inhibition of heart will happen, and because of that the person will die. So, this is how the death happens in case of gagging. So, these are the main types of suffocation. Apart from that, there is one more thing that we have to know in suffocation that is kind of important, that is your choking. So, choking, what happens is that here also kind of similar mechanism to gagging, but the thing here is that here the obstruction will be in the tracheal level, like beneath the larynx, beneath the laryngeal level, there will be obstruction beneath the laryngeal level. So, what happens is that usually choking, it is done by some small particles like your food, like something like a bone, like fish bone or something, or sometimes some small toys, some buttons, caps, all these small things. What will happen is that people, they will ignore, and sometimes it is usually seen in case of children. Like what will happen is that they will inhale those things, or they will put it inside their orifices, something like that. They will intentionally or accidentally, they will put all these small particles and they will go inside. So, it will go beyond the larynx and it will cause obstruction in the trachea, or the bifurcation, beyond the bifurcation, secondary level, everywhere it will go and obstruct. So, because of this obstruction, there will be asphyxia. So, this we call as choking. So, this is the main thing in case of choking. So, beneath the level of larynx, due to these particles, there will be obstruction which will result in the asphyxia. Now, we have one more condition known as cafe coronary. So, this cafe coronary, this is somewhat similar to the choking, but here what happens is that this cafe coronary, this is typically seen in case of heavily drunk individual. So, heavily drunk individual. So why we are saying this heavily drunk is that their reflexes will be very much less. They will have less reflex. It will be off, totally off in case of few people. So what happens is that they will be heavily drunk and they will go and they will have a food, and sometimes a bolus of food, like this words, this bolus of food, heavily drunk patron, heavily drunk individual. All these words are very typical to this cafe coronary. So they will heavily drunk and they will have these food, and this bolus of food, it will go and obstruct. So once this obstruct, all of a sudden they will die. So this will go and obstruct and suddenly they will just gasp and they will die. So here what happens is that this bolus of food, this will go and activate vagal reflex, which in turn will affect the heart. So this cafe coronary means what happens is that they will go to a cafe, they will have drink and they will eat food, and this heavy bolus of food, it will go and obstruct, which will in turn instantly cause death because of the vagal inhibition of heart. So this is your cafe coronary, and this is the Heimlich maneuver. So this Heimlich maneuver is something that we use to prevent choking or this cafe coronary. So what they will do, they will give pressure just below your sternum, like over your abdomen, upper abdomen, just below the sternum, they will give a push. Okay, they will just push it and the bolus or the particle, it will come out of the mouth. So this is the Heimlich maneuver. So these are the basic types of the suffocation. So starting with your smothering, burking, then your gagging, finally choking and cafe coronary. So these are the basic types of suffocation that we have to know. Now we are done with the types. Now we are going to see what is the mechanism, how the death occurs in case of hanging. This is very important. This itself is a 5-mark question, or they can ask in the 2-mark as well. So here what happens is that the mechanism of hanging, we have not just one mechanism, we have actually some 4 mechanisms in the hanging. So first mechanism is obviously your mechanical asphyxia. So this is mechanical asphyxia, means obstruction of the trachea. So this obstruction of trachea, it is one mechanism that leads to death in case of hanging. And this question, what is the pressure that is required for the obliteration of the structures, that they will ask. So for jugular vein, it is 2 kg. For carotid, it is 5 kg, and trachea 15 kg, then vertebral artery, it is 30 kg. 2, 5, 15 and 30. You just increase 5, then 15, then 30. Since vein is very easily compressible, very small structure, you just put 2. So this pressure, they can ask you. What you have to remember mainly here is that which is easily compressible and which is the very last thing to compress. So vein, easily compressible, it comes first. After that, you have the 2 things. Apart from vein, you have 2 other things in the neck, that is your artery, then your trachea. Between these 2, which is more resilient is this your trachea. So trachea you need 15 kg and carotid artery 5 kg. And this vertebral artery, why we have given this 30 kg is that this is very posterior. This is not like very present in the front of the neck. So because of that, you get 30 kg of pressure to obstruct this vertebral artery. So this is how much pressure is required for this obliteration of structure. Now we have seen one mechanism of death, that is mechanical asphyxia due to obstruction of these trachea. Next mechanism what we have is venous congestion. So here what happens is that mostly in case of partial hanging. So in case of partial hanging, what happens is that these venous structures, even if the pressure is very less, even if the pressure is only 2 kg, this venous structure, it will be easily obstructed. Because of that, you will get the venous congestion, which will result in the cerebral anoxia, that will cause death. So this is another mechanism. You have obstruction of trachea, then you have venous congestion, Now another mechanism, that is cerebral anoxia, that is due to obstruction of carotids, direct obstruction of carotid, which will result in the cerebral anoxia. Either it can be caused indirectly by obstruction of the venous resulting in venous congestion, or it can be caused directly by obstruction of the carotid. When the pressure is about 5 kg, it can happen directly. So we have seen 3 mechanisms. Apart from that, you have one more mechanism that is very common among judicial hanging. So you have very common among judicial hanging, that is what will happen in judicial hanging? There will be fracture of cervical vertebra. So fracture of cervical vertebra, which will result in the death. So this is another type of mechanism. And finally, you have one more mechanism, that is due to vagal inhibition. So you have the cervical plexus, right? Cervical sympathetic strain system, everything is present over the neck. So when the cervical system is activated, you can get this vagal inhibition of heart. So when the death is very instant, this vagal inhibition of heart is very common. If it is a partial hanging, this venous congestion is very common. So these are the mechanism, 5 types of mechanisms through which death happens in case of hanging. So here I want to say one more thing, which is mechanism of death versus cause of death. So this is very important here. So when I say mechanism means how the death happens, through which modality, how it is happening, and cause of death is why it happened. When I say cause of death, it only means the condition, the disease. Here the condition or disease is hanging, and the mechanism of death is mechanical asphyxia. So mechanism is asphyxia, cause is hanging. Because of hanging, the person died by mechanical asphyxia. So mechanism is different, cause is different. When we say cause, it is usually the disease or condition. Like someone is dying because of a myocardial infarction, we say cause of death is myocardial infarction. But the mechanism of death there is cardiac arrest. So if it is a case of MI, cause of death is myocardial infarction, but mechanism of death is cardiac arrest or cardiorespiratory arrest. So this is how the cause of death and mechanism of death differs. So now do you understand what I mean by the mechanism of death in hanging? So hanging is the cause, and by which mechanism hanging results in death is these 5 mechanisms. First is your obstruction of trachea, second is the venous congestion because of obstruction of jugular vein, third is the obstruction of the carotid artery which will result in cerebral anoxia. Then you have the fracture of cervical vertebra which is commonly seen in judicial hanging. Then finally your vagal inhibition of the heart. So these are the 5 mechanisms through which hanging results in death in a person. And this mechanism question is very important with related to university exams. Done. Now we have seen the mechanism of death. Now we are going to see the post-mortem findings, which is also a very important part. So this is the main part in forensic, right? So post-mortem findings, the first thing that we have to note is the triad of asphyxia. So what is the triad of asphyxia? Going back, what is the triad? It is the congestion, petechiae and cyanosis, right? All these 3 things you can expect to see in all asphyxial death. Congestion will be there, petechiae will be there, and your cyanosis will also be there. And this Tardieu spot, we say something known as Tardieu spot. So this is nothing but small petechiae, and these petechiae, when it is seen over the face, especially over your eyelids, conjunctiva, we call them as, this is nothing but petechiae, but when it is seen in asphyxial death over these face, eyebrow, eyelids and these conjunctiva, we call them as Tardieu spot. And this Tardieu spot, it is one of the important finding, post-mortem finding in case of all the asphyxial death, especially hanging. So this Tardieu spot you will see. Then you will get to see other cyanosis and congestion of the internal organs you will see. Now, apart from that, coming to the most important part, this, your ligature mark. So, ligature mark is very important finding in case of hanging. So, here do you see this thing? This is your ligature mark, and this ligature mark, it is nothing but your abrasion. It is your abrasion. We call it as a pressure abrasion. To be exact, it is a pressure abrasion. So, this is nothing but an abrasion which is seen over the neck. And this ligature mark, whenever you come across the ligature mark, you have to explain what is the measurement. You have to explain the measurement. You have to explain the exact position, whether it is below thyroid, whether it is above thyroid, whether it is continuous or not, whether it is oblique or transverse. All these things you have to explain. And usually this ligature mark, when you get a body for autopsy, how this ligature mark looks like is that you will have these hard parchment like dark looking abrasion. This is how you usually get a ligature mark in case of hanging. So, hanging you will get ligature mark, which is very classical, and this ligature mark, whenever you get, you have to note down all these findings, and it will usually look like a very hard dark color structure. And why I meant this position, continuous, oblique, is that when we measure how it looks and when we see how it looks, we can actually differentiate whether it is a hanging or strangulation. Why? Because is that in case of strangulation also there is constriction of neck. Sometimes ligature will be used, like only in manual strangulation we use the hand. Apart from that, all other strangulation ligature is used, right? So in both strangulation and hanging, you will be getting these ligature mark. So ligature mark, it is seen in both hanging and strangulation. So without any history, if a body is present to you with ligature mark around the neck, you will be able to identify whether it is due to hanging or strangulation based upon few findings. We will see all those findings now. So first finding is that, so this is a hanging and this is a strangulation. So the first finding would be, it will be oblique. Here it will be transverse. So what I mean by oblique and transverse is that, here, see, do you see this? This is going up. Here this is going straight, right? So this is going obliquely upwards. Here this is going straight. This is transverse. So this is oblique. So it is going upwards means it is going towards the point of suspension. So point of suspension means it has to be hanging. If it is not going towards a point of suspension, if it is going straight transversely, then it has to be most probably a case of strangulation. So this is the first difference between hanging and strangulation. Up next, what the difference is that you have an incomplete ligature mark in case of hanging, while in case of strangulation it will be complete. So what I mean by complete and incomplete is that, so just imagine this is a person getting hanged. Now if they are hanging from, this is the point of suspension. Okay, so this is where they are hanging from, and here this is how the rope will be. So now what happens if the knot is placed over here and this is the point of suspension, like just imagine something from the rope, so like from fan or something. They are pushing the rope from there. So what will happen? The knot will come here and the ligature mark is over the front. Now if it is pushing upwards, this area, so here this area, it will be free. It will not have any sort of ligature mark. since the point of suspension is here, it will be pulling upwards. So, this area will be free. So, this thing, so what we call is that this thing is known as suspension peak. This is known as suspension peak. So, you will basically, when you look at the both direction, you will get a triangular thing here. So, you will get a triangular thing here, and this suspension peak, it will be towards the suspension point. This peak, this apex, it will be usually pointed towards this suspension point. So, this usually this free area, we call it as the incomplete ligature mark of hanging. Clear? And if it is the case of strangulation, what happens? They will use the ligature to constrict the neck, right? So, they will usually cross over or they will just twist it over. Anyhow, that ligature mark, it will be completely encircling the neck. So, here the mark will be completely encircling the neck. So, this is how the second difference look like. So, first it is oblique in case of hanging, transverse in case of strangulation. Second is that incomplete ligature mark with suspension peak is seen in case of hanging. Complete ligature mark with sometimes crossing over is seen in case of this strangulation. And another important point is that usually this hanging, this ligature mark, it is seen above the level of thyroid. In most of the cases, the ligature mark, it will be seen above the level of thyroid, while in case of strangulation, it will be usually at or below the level of thyroid. So, this is how the strangulation ligature mark looks like. So, by seeing this, by looking for these differences, when a body is presented to you only with ligature mark without any history, you can easily identify whether it is a case of hanging or it is a case of strangulation. You can easily identify in this. So, this is how the postmortem feature is written in case of a hanging in PM report. So, this. So, first we have seen the Tardieu spot, then we have seen the ligature mark. So, up next what we are going to see is this postmortem staining. So, postmortem staining, we have one name, glove and stock type of PM staining. We call it as glove and stock type of postmortem staining. Why? Because is that, so postmortem staining, what happens? So, when a person is hanging, if the person is suspended, what will happen? They will be in an upright position, right? They will be put in an upright position. Here, the dependent part would be your hands and feet. So, when the person is upright, the dependent portion would be your hand and feet. So, only in the dependent portion we will be seeing this postmortem staining. So, the postmortem staining will be seen over only the hand and the foot, and usually in hand and foot we usually wear glove, right? Glove and stocking. So, we call it as this glove and stocking type of postmortem staining. This is seen in case of hanging. And if it is a strangulation, if the body is lying supine, it will be seen over the usual position, that is your posterior aspect of the body. So, this is the postmortem staining. If it is a hanging, if the body is suspended, you will get to see this glove and stocking type of postmortem staining. Then, next what we have is this saliva. So, this saliva marking is very, very important. So, there will be usually dribbling of saliva. So, what happens is that when there is a constriction of the neck, the salivary glands that is present, like the submandibular glands, all those glands that is present in the neck region, they will result in excess production because of this irritation, because of this pressure. There will be excess production of saliva, and this saliva, it will accumulate in the mouth and it will start dribbling down. And this dribbling of saliva, it is a very, very classical and surest sign of antemortem hanging. Like this salivary stain, this is very, very important. Whenever a case comes, whenever they say it is a case of hanging, we look for this salivary stain. It is usually present opposite to the knot, opposite to knot. So, if a knot is present over there, opposite to the knot, over the angle of the mouth, you can see the salivary dribbling, and sometimes it will be present over the clothing also. If there is lot of dribbling, it will be present over the clothing, and you can see the salivary stain over the clothing, and if it is there, you have to preserve it. So, this salivary staining, this salivary mark is very, very important, and this happens because of the constriction of the salivary glands by the ligature. So, this dribbling is one important feature. So, next to that, there is another feature, that is leaf faces sympathy. So, here what happens is that in this leaf faces sympathetic, what happens is that there will be cervical sympathetic chain. The cervical sympathetic chain will be compressed by the knot. So, the knot, it will compress the cervical sympathetic chain. So, because of this compression, what will happen is that on the side of compression, there will be open eyes with dilated pupils. On the side of the compression, there will be open eyes with dilated pupils, while the opposite side it will be closed. So, this leaf faces sympathetic is also one important feature that is frequently asked. So, you have dribbling of saliva, leaf faces sympathetic, Tardieu spot. These are very, very specific feature that we see in case of hanging. So, this is the external features that we usually see in case of hanging, and ligature mark is very, very important. Apart from that, there is one more question that is usually asked is, what is the order of opening the cavity? So, usually what we do is, we will open the area of interest. So, if there is any injury, we will open that area first, then we will do the rest later. But in case of hanging, what will happen is that if you open the neck first, so area of interest is obviously neck here, but if you open the neck first, what will happen is that because of this extreme congestion, there will be very, very bloody field. There will be lot of blood, and if you make a nick very accidentally, unfortunately, if you nick a blood vessel, the whole neck it will be filled with blood, and you won't be able to explore any further. So, this kind of thing, this bloody field that is created by your accidental nick, we call it as Prinsloo artifact. So, this bloody field that is created by the accidental nick, we call it as Prinsloo artifact, and sometimes because of the hypostasis also, we will be getting this Prinsloo artifact. So, this is the reason why we don't open neck first. So, in case of hanging, usually we open neck at very, very last. We will open the abdominal organs, we will open the thoracic cavity, we will open the head, we will drain out all the blood vessels through the cranial cavity. After that only, at the end only, we will be opening the neck, because so that we can get this bloodless field for exploration. So, this is the order of opening cavity. Whatever you open first, you can leave it, but open the neck at last. That is the main thing in case of hanging. Now, this is the post-mortem features externally that is important. Now, we are going to see about the manner of hanging. So, manner of hanging, you have first is your suicidal, then accidental, then homicidal. So, these are the manner of death. So, I have already told you what is the cause of death, what is the mechanism of death. Now, this is the manner of death. So, manner of death means it can be either suicidal, accidental or homicidal. So, now when we say the manner of hanging, we have the most common manner, that is suicidal. So, suicidal manner of hanging most common, and next to that we have two other types, that is accidental and homicidal. And in this homicidal hanging, we call it as lynching. So, if it is a homicidal hanging, we call it as lynching. So, lynching, it is also known as mob lynching. What happens here is that it is used to be done to slaves. So, if they do something wrong, what they will do is they will make a parade. They will just beat them out and they will just like put some rope over their neck and they will just push them around, just do a parade, and they will go and they will hang them, like homicidal. People will hang the slaves from a tree or something, just to show a lesson, just to show around that people cannot do these type of mistakes, just to teach them a lesson. They will do this sort of activity. This is known as mob lynching. What they do is hanging only, but it is done in a homicidal manner. So, homicide means it is a murder, killing, someone else is doing it. So, this homicidal hanging, we call it as lynching. So, suicidal manner we have already seen. Now, homicidal manner, that is lynching, we have seen. Next, the left manner is your accidental hanging. So, someone when gets accidentally hanged, we call it as this accidental hanging. And this accidental hanging, it is commonly seen with sexual hanging. It is also known as asphyxiophilia, autoerotic asphyxia, and sexual asphyxia and Kurzweilism. So, these are the other name for this sexual hanging. So, what happens is that because of this constriction of the neck, due to the constriction, there will be cerebral anemia. When the cerebral anemia is mild, they will have these hallucinations. These hallucinations would be erotic for few people. So, to get these hallucinations, this erotic hallucination, people, they will hang themselves. Like what they usually do is, it is a more controlled type of hanging. So, it is a controlled type of hanging. What they will do is, they will have the rope or the constricting force in their hand. It will be in their control. So, they will push it and there will be constriction of that, there will be cerebral anemia, they will be experiencing that hallucination, and once they are going overboard, they will lose their hand. So, the constriction will become normal, they will not be experiencing any hallucination. So, they will do it again, like that they will keep on repeating. This is how it is usually done. But when unfortunately this control is lost, they will hang themselves. So, this hanging, when it is not intentionally done, they did not do it to kill themselves, they only did it for this hallucination, this erotic feeling they did, but still they are getting hanged accidentally, right? So, these type of hanging, we call it as asphyxial like sexual asphyxia or accidental hanging. So, this is your sexual hanging. And what happens is that in case of this sexual hangings, you usually see some associated paraphilia, that is your transvestism. They will be usually wearing the clothes of the opposite sex, that is your transvestism, and there will also be masochism, like they will experience pleasure by inflicting pain upon themselves. So, masochism is inflicting pain upon themselves, inflicting pain upon themselves. So, this is opposite to sadism. So, sadism, they will inflict pain upon others and they will enjoy it. Masochism, they will inflict pain upon themselves and they will have this erotic feeling from that. So, these are the usual associated paraphilias they get in case of this sexual thing. And mechanism of death, it is mostly cerebral anoxia or venous congestion. These are the most common mechanism of death through which they die in case of these accidental hanging. And what happens is that these hanging, it will be in 99%, like most of the cases, it will be an incomplete hanging. So, this will be a partial hanging, like they will be sitting upon something, they will have the noose over their hand. So, this noose will be controlled by the person. And neck, usually they will have some sort of padding present. So, just to like if you constrict the neck, you will definitely get these ligature marks, right? You will get some sort of abrasion or something over the neck, right? but it will be seen to everyone. So people will start asking questions. So to prevent that, what they will do is they will put a padding and they will put the ligature over that. So when you do that, you will not be seeing any ligature mark. So if you look at their neck, sometimes the padding along with the ligature will be present. So this padding thing, it is very important in another context also. What happens is that in few hanging cases, you will not get to see any ligature mark. I have told you that ligature mark is a classical finding in case of a hanging. So whenever you see a ligature mark, you immediately think of hanging. But sometimes what happens is that in case of hanging, there will not be ligature mark. So hanging with no ligature mark, it is seen if there is any padding present or if there is decomposition. So once the decomposition sets in, the ligature mark will be gone, or if there is any like fat neck or something, if there is very broad neck, you will not be able to see the ligature mark properly. And if a soft broad ligature is used, you will also not be seeing ligature mark under those conditions. So hanging, it usually comes with ligature mark, more classically comes with ligature mark, but in few conditions there may not be ligature mark, and those conditions are if there is any padding or decomposition present or the ligation material is soft and broad. Under those conditions, even if the death is due to hanging, you will not be able to see this ligature marks. So this question can also be asked. So this is one important thing in this context. So coming back to this sexual asphyxia, why they do is that they will get these hallucination due to the cerebral anemia, and when they lose the control, they will accidentally hang themselves. So this is the sexual asphyxia, which is a type of accidental hanging. So done with the manner of the hanging. Now we are going to see the other few important terms in this. So first is your dyadic suicide. So dyadic suicide is known as pack suicide. So here what happens is that this is something very famous. So they will make a pact that they will die together. Like usually lovers or people with some superstition, what they will do is they will talk amongst themselves. They will make a pact, sort of promise. They will promise to each other that we will die together. So this is known as dyadic suicide. So this dyadic suicide, the most common method used is your hanging. So this is dyadic suicide. Then you have another term known as para-suicide. So para-suicide is mostly a failed suicide attempt. So they will attempt suicide, but they will not die because of that. So this is known as para-suicide. Sometimes they will intentionally do that to just make people fear them. So they will do this attempt suicide, but they will not die because of that act. So this is para-suicide. And you have something known as post-mortem suspension. So post-mortem suspension means they will kill somebody and afterwards they will suspend the body. Like not necessarily kill, like they would have died of another reason. But to mask that, they will hang the body, they will suspend the body. We call it as post-mortem suspension or post-mortem hanging. So this is one other term related to hanging that is usually asked. So post-mortem suspension is when a person has died because of another reason, to mask that reason, they will suspend the body. So this is post-mortem suspension, otherwise known as post-mortem hanging. Next you have the judicial hanging. So judicial hanging, this is the method that is used for judicial killing in India. In most of the countries also they use this. So for judicial killing in India. So what happens is that the knot placement, the ideal spot for placing the knot is the jaw. So beneath the jaw they will place the knot and they will let the person fall equal to their height. So if a person is 160 centimeter high, what they will do is the length of the rope they will make it so long that they will fall for this 160 centimeter. So they will just suddenly open the fall and the person will fall for 160 centimeter, so that there will be immediate fracture of the cervical vertebra. So you have the fracture of cervical vertebra. So this will cause instant death. So this fracture of the cervical vertebra will result in instant death, and this fracture we call it as hangman's fracture. So this is the name of the fracture that is seen in this judicial hanging. And this hangman's fracture, like when they simply ask you what is a hangman fracture, what you have to say is this: it is traumatic spondylolisthesis of axis. So it is due to trauma, and what happens is that there is spondylolisthesis, and of which vertebra? It is the axis. So this is what the definition usually is. So what is the hangman's fracture? It is traumatic spondylolisthesis of axis. And apart from that, you have few types of hangman fracture. You have 3 types. So what happens is that in type 1, there will not be any displacement. It is a non-displaced fracture. But in case of type 2, there will be displacement. So displacement, if it is present, we call it as type 2. If it is not there, it is type 1. And type 3, what happens is that there will be pars interarticularis fracture with dislocation of C2 and C3 facet joints. So all these happens in case of these type 3 fracture. So type 1, you get non-displaced fracture of pars interarticularis, and in case of type 2, you have displaced fracture of this same pars interarticularis. Here type 3, what happens is that you have the fracture of the pars interarticularis with dislocation of C2, C3 facet joints. So this is the 3 types of hangman fracture that is usually asked. So mainly if they simply ask you what is a hangman fracture, what you have to say is this: traumatic spondylolisthesis of axis. And if they further ask you about the types, you can write about these 3 types of fracture in judicial hanging. And judicial hanging, the ideal position for knot placement is beneath the jaw, and the height of the fall should be equal to the height of the person, and here the death is usually instant. So these are the important terms related to hanging. So up next we have the manner in case of strangulation. So manner of death in case of strangulation. So manual strangulation, it is also known as throttling. So this manual strangulation, it is always suicidal. You can also have accidental hanging, accidental strangulation. You can have accidental strangulation, which is also known as Isadora-Duncan syndrome. So here what happens is that the long scarf like a dupatta, it is used to constrict the neck. Like accidentally, when people are going in the bike, if the long scarf or something, it is getting stuck in the wheel, it can constrict the neck. So this type of accidental strangulation, it is known as Isadora-Duncan syndrome. Apart from the children, while they are playing, they can get strangulated accidentally. And suicidal strangulation, it is very rare, and if it is a manual strangulation, we can always say it is always homicidal. It is always homicidal. So this throttling is always homicidal. So this is the manner of strangulation. So when we deal with the manner of strangulation, you have accidental strangulation, that is Isadora-Duncan syndrome, homicidal strangulation, which is manual strangulation or throttling, and suicidal strangulation, which is very rare. And in case of manual strangulation, there are certain specific features that is important to know. The first external feature that is important here is that this. You see this semilunar shaped marks. See this semilunar shaped things. These are your fingernail fingernail abrasion. So this is your fingernail abrasion, and they are typically semilunar shaped. You get semilunar shaped abrasion which is fingernail caused by fingernail, and you also get something known as sixpenny bruises. So this, all these are your sixpenny bruises. So these are nothing but your bruise which is caused by the finger pad. So when someone is using their hand to constrict the neck, to strangulate, what happens? These finger pad, it will dig in. So because of this, if there is nail, this nail will result in this semilunar abrasions. And this finger pad, this will push further and it will result in this bruises. So these two findings, they are very important in case of strangulation. And this strangulation, this mainly causes death by venous congestion. So venous congestion is the most important mechanism of death in case of strangulation, and because of this venous congestion, you will get to see extreme fatigue and congestion. So there will be very bloody feel, like it will be in the face will be completely darkened or bluish in color, and when you cut open the neck, you will get to see lot of muscular tears. You will get to see muscular tears, like all your neck strap muscles, it will be teared. So you will get to see muscular tears, and you will also get to see hemorrhages. So because of this extreme pressure, there will be tear of the muscle and hemorrhagic spot will be seen in the neck. Internal findings. In the internal finding, you will be getting to see this. So apart from that, you will also get to see fracture of hyoid bone. Fracture of hyoid bone, which is mostly abduction fracture. So abduction fracture of hyoid bone is usually seen in this throttling or manual strangulation. So manual strangulation itself is a important question. What they usually ask is what is the manner and what are the external findings that you usually see, and what are the internal findings that is very typical to this manual strangulation. So manual strangulation, other name throttling, and all these features you will be seeing in case of this. And in few cases they may ask what are the internal findings, internal PM findings in case of hanging and strangulation. So this internal finding also sometimes they will ask you. So external finding, it is almost similar. You will get to see all the Tardieu spot, ligature mark and all, and difference in the ligature mark you will write. But internal feature when it comes, there are certain differences that we have to note down in these two. So first, internally in case of hanging, when you cut open the neck, okay, the cross section of neck, it will be very pale and shiny, and there will be no muscular tear, and there will be no congestion or hemorrhage. But in case of strangulation, you can see congestion and some muscle tears. It will be present in case of strangulation. It may not be as severe as this throttling, but still you can get to see some congestion and muscular tear in case of strangulation, while in hanging there will be nothing. It will be very pale and shiny. So cross section of neck will look like this. Apart from that, you will get fracture of hyoid. So this fracture of hyoid, you will get something known as anteroposterior compression fracture. So this anteroposterior compression fracture, it is same. It can be seen in strangulation, hanging, both. So this internal feature you can see. And next internal feature is Simon's hemorrhage. So this Simon's hemorrhage, it is seen only in case of hanging, not in case of strangulation. So what the Simon's hemorrhage is that? It is the hemorrhage seen in vertebra, especially lumbar vertebra. Body of lumbar vertebra, you will see this Simon's hemorrhage, and it is seen only in case of hanging, not in strangulation. Next to that, what you can see is Amussat sign. So, Amussat sign. This is also seen only in hanging, not in strangulation. So, this Amussat sign is ladder shaped tears. Ladder shaped tears in carotid, intima. So, this is seen only in case of hanging, not in strangulation. So, normally when they ask you what are the internal findings in case of hanging and strangulation, what is the main difference between these two? These are the main difference that you have to focus upon. External features we already saw, these are the internal features. So, with this mechanical asphyxia is done. Up next, what we are going to see is drowning. So, drowning, it is also a type of special type of mechanical asphyxia. So, here what happens is that the air entry is prevented from lungs by mechanical entry of water. Mechanical entry of water. So, here what happens is that basically in the lungs, air is getting replaced by the water. So, this we call it as drowning. In case of drowning, there are few important types that we have to know. So, first you have dry drowning, then you have wet drowning, then you have hydrocution, then you have near drowning. So, these are the main types that we are going to see. So, when I say dry drowning, what I mean by that, there will be no water in lungs. If there is no water in the lungs, but still the patient has died because of drowning, we call it as dry drowning. If there is water present in the lung, we call it as wet drowning. And hydrocution is, there will be instant death once the person touches water. So, this hydrocution is also known as immersion syndrome. So, hydrocution, what happens is that the person will instantly die once they hit the water. And near drowning is when when drowning happens but the patient survives. Patient survives an episode of drowning. So, these are the types of drowning that we have to see. So, dry drowning, there will be no water in lungs, but the person has died because of drowning. So, when that happens, when can this scenario occurs is that first is your laryngeal spasm. When there is laryngeal spasm, this happens when there is cold water. So, because of this cold water, when a person enters a cold water, they will inhale those cold water. When this cold water touches the larynx, there will be reflex. Because of the reflex, the larynx will go into a state of spasm. So, the larynx will spasm and air will not enter, water will not enter, asphyxia will happen, death will happen. So, this is dry drowning. Wet drowning, the usual mode. So, water will enter the lungs, it will replace the air, and because of that, death will happen. And this wet drowning, you get two types. What is? Salt water and fresh water. These are the two types of wet drowning. And hydrocution, they will touch the water and they will instantly dry. This is most commonly seen with duck diving. So, what happens is that when the cold water, also like cold water, what happens? When it touches their abdomen or any exposed skin, when it touches the skin, it will result in the reflex vagal inhibition. So, it will result in reflex vagal inhibition which can cause instant death. So, that is your hydrofusion, and finally is your near drowning where the patient survives an episode of drowning. So, these are the main types of drowning that we are seeing. And this drowning, the main thing that we have to know is the pathophysiology in freshwater drowning and saltwater drowning. Saltwater, that is your seawater drowning. So, this is very important question. This pathophysiology they have asked multiple times. So, now what they will ask you is that what happens inside the body following this drowning. So, when a person enters fresh water, when they drowns by fresh water, what happens is that they will inhale water. So, they will inhale lot of water, and this water, it will enter the lungs, and this fresh water, it is usually hypotonic. So, because of this hypotonic, osmotic pressure will start working. So, this osmosis process, what will happen? It will take all the water from the lungs to the blood. So, water from the lungs, it will enter the blood because of this osmosis. So, there will be hemodilution. So, hemodilution happens. Now, this hemodilution, it will result in increased blood volume. So, blood volume will increase from 3 liter, it will become some 4 or 5 liter. So, this increased blood volume, it will in turn cause this dilution of plasma and rupture of the RBCs. Because of the increased pressure, there will be rupture of the RBCs, and when cell get ruptured, there will be release of potassium ions. So, this potassium ions will be released which will cause hyperkalemia, and this increased blood volume, it can overload the heart. Increased volume means heart has to do lot of pumping. So, this overloading heart can result in ventricular fibrillation, and this hyperkalemia itself alone can result in this ventricular fibrillation. So, because of that, there will be arrhythmia and heart failure, eventually death. So, this is how the freshwater drowning results in death. So, there will be inhalation of water into the lung. Because of the hypotonicity of the fresh water, water from the lung will enter the blood. So, water from the lung enters the blood, which will result in increased blood volume, rupture of the RBCs, eventually hyperkalemia and arrhythmia. So, when they ask you how death happens here, it is mainly arrhythmia. Freshwater drowning, it is arrhythmia. And saltwater drowning, that is your seawater drowning, what happens here is that the same thing, the water will enter the lungs. So, water will enter the lungs, and because of the hypertonicity of the water, there will be movement of water from blood. So, from blood, water will enter the lungs. So, water from the blood entering the lung, what will happen? It will result in hemoconcentration. The water content of the blood will reduce. So, that you will have hemoconcentration in the lungs, you will have pulmonary edema. So, this pulmonary edema, it will result in shock and heart failure. So, here the death is mainly due to pulmonary edema. This is mainly due to the failure. So, freshwater, it is arrhythmia. Saltwater or seawater, it is pulmonary edema. And what here they will ask you is, they will ask you, you will see hyperkalemia in which drowning? That is your freshwater drowning. They can ask you hyperkalemia will be seen in which drowning? That is freshwater drowning. Then they can ask you something like where you will be seeing hemoconcentration. That would be saltwater drowning. Saltwater or seawater drowning, you will be seeing this hemoconcentration. Hemodilution, it will be seen in freshwater drowning. Then they will ask you where you will be seeing hypernatremia. This is seen in seawater. And hyponatremia, hypochloremia, in every electrolyte is decreased. It is seen in freshwater drowning. Except for this potassium, all other electrolytes, it will be reduced in case of freshwater drowning. This sodium, it is only increased in case of seawater drowning. So, this is the main thing they will ask you. They will ask you like hyperkalemia, where it will be seen, hemoconcentration, where it will be seen, hypernatremia, where it will be seen, hyponatremia, where it will be seen. Like that they will ask you questions and you can answer accordingly. And this pathophysiology is very important. They will ask you what is the pathophysiology behind seawater drowning, what is the pathophysiology behind freshwater drowning. Like that they will be asking you what exactly happens. So, you can write these pathophysiology for the short answers. And now, next we are going to see the post-mortem finding. So, post-mortem finding in case of drowning is very important. Why I am saying is that the most common way people used to dispose of body is through like dumping in water. So, dumping in water is the most common way people would try to dispose of the body. So, you have to identify whether it is a case of antemortem drowning or post-mortem drowning. So, this is very important, and starting with the external feature, we will first see this. So, this you can see they are holding some aquatic plants in their hand, and it will be very hard to break away. Like you cannot remove the fingers and plant away from the hands. This kind of condition is known as cadaveric spasm. So, this is your cadaveric spasm, and this is a surest sign of antemortem drowning. This is one of a surest sign of antemortem drowning. So, what happens is that when a person falls inside the water and then dies, they will try to catch something, like to hold on to something, they will try to grab onto something. So, they will get these aquatic plants. Sometimes they will have some stones or some other items that is usually found under the water in their hands. And this cadaveric spasm, it is one important sign that we can use to identify whether it is a case of antemortem drowning or post-mortem drowning. So, this is the first thing. Next, in all cases of drowning deaths, be it an antemortem or post-mortem death, you will be seeing this. This is a very classical finding you will be seeing in a dead body found in water, that is this presence of froth in mouth and nose. So, you will get to see this white lather like the lather bubble that you will get when you wash your hands, like the soap bubble, that kind of lather. You will be getting this white lather like tenacious froth. This is the exact appearance. So, it will be white in color, it will be very lathery, and it will be tenacious, meaning the bubble would be very hard to break, not hard as in very hard. Like normally when you break a bubble, it will be easily breaking off, but this bubble, it will resist a bit more, mainly due to the presence of protein. So, what happens is that when these water enter your respiratory pathway and lungs, because of the irritation, there will be lot of production of your mucus. So, mucosal production will increase, and all these mucosa, it is consisting of proteins, right? So, this protein along with this bubble, it will form these kind of tenacious structure which is kind of hard to break. So, that is the appearance of this bubbles. So, you will get this cadaveric spasm, then you will get this white lathery froth over the mouth, and this froth, what will happen is that if you wipe it off and if you push the chest, it will keep on coming. Like whenever you wipe it off, after some time if you look at the body, there will be some more froth present. So, it will keep on coming, this froth. And next to that, you will get to see some non-specific sign, that is this washerwoman hand and feet. Washerwoman hand and feet. So, here what happens is that just because of immersion, it doesn't mean the person was alive or dead before immersion. Like it just, the body has to be immersed in water. Even if you are alive, if you put your hand inside water for some time, you will get these kind of findings. So, this is known as washerwoman hand or feet. So this is simply a sign of immersion. From this you cannot say whether it is an antemortem drowning or postmortem drowning. You can only say that the body was recovered from the water. So this is a sign of immersion. So this is another finding that you can see. And apart from that, you can also see this goosebumps. That is due to erection of erector pilaris. So your erector pilaris in the skin, this will erect. Because of that, you will get these goosebumps appearance. And both these two, these washerwoman hand and goosebumps appearance, this is our like sign of immersion, not a sign of antemortem or postmortem drowning. It is simply a sign of immersion. So amongst these four things, the main thing that is important is this cadaveric spasm, because this is the only surest external sign of antemortem drowning that you can find. So this is the external finding that you usually see in case of drowning. Apart from that, there are few other things that we have to know in drowning. One is post-mortem staining. So post-mortem staining, when there is a constant current in the water, that is the water is keep on moving, there will not be no stain. So if there is a constant current, you will not get to see any post-mortem staining or hypostasis in the body. This one thing they will ask you. And apart from that, if the body is been inside the water for a long time, sometimes some aquatic animals, they will nibble on the body. So there can be some injuries, some artifact that can be seen over the external surface of the body. That is also commonly found in drowning death. So next we are going to see the internal finding. So internal finding, the first important finding is this presence of froth in trachea, especially in terminal bronchiole. So if you see froth present all over the respiratory passage, even beyond the bifurcation of trachea, inside the secondary bronchi until up to the minute terminal bronchiole level, then it is also one surest sign of antemortem drowning. And apart from that, you can also see vegetation or dirt present in terminal bronchiole. So these two, if these two are present even beyond the bifurcation of trachea, if there is froth or any aquatic plant, vegetation, any dirt, then we can say it is a surest sign of antemortem drowning. So this is the most important internal finding that we have to know. Apart from that, there is one more important question that they can ask is this pult of hemorrhage. So what is this pult of hemorrhage is that, see this here, do you see a hemorrhage? So this is simply a hemorrhagic spot seen over the pleural surface of lung, mostly over your lower lobes, anterior aspect. So anterior aspect of lower lobe, sometimes over the margins you will getting to see this hemorrhagic spot. So this is mainly due to rupture of the alveoli. Because of this extreme respiratory effort, you will get to see this alveolar rupture resulting in this hemorrhagic spot. And this is seen here over the anterior aspect of the lower lobes, and this is known as pult of hemorrhage. And next thing that we have to know is edema aqueous and emphysema aqueous. So edema aqueous and emphysema aqueous, these are like when there was no advancement in the autopsy techniques, in all imaging techniques, they used to have these theory. Like emphysema aqueous means when the antemortem drowning happens, you will get to see pulmonary edema. So, there will be pulmonary edema, and you will also get to see this emphysematous features. And if it is a case of post-mortem drowning, you will only seeing the pulmonary edema, not these emphysematous features. So, these are very absolute now, they are not using it now, but just to know what is edema aquosum and emphysema aquosum. Edema aquosum, it is seen in post-mortem drowning. Emphysema aquosum, it is seen in antemortem drowning, but these are not accurate. And one more accurate thing is that you will get to see massive pulmonary edema. So, this pulmonary edema, it is also one important feature in case of drowning death. And these are the main findings that we see in case of drowning. If you see any aquatic vegetations, if you see froth beyond the level of trachea inside the bronchi, then you can surely say that these are cases of antemortem drowning. So, finally, if they ask you what are the surest sign of antemortem drowning, you have the surest sign. Till now, you have cadaveric spasm. Then you have the presence of vegetation and froth beyond bifurcation of trachea. So, these are the surest sign till now we have got. After that, you have the diatom test. So, this diatom test, it is very, very important. It can be asked in spotters or it can be asked as a 5 mark also. So, what happens in diatom test? First of all, what is diatom, that we will see now. So, what is the diatom? So, diatom, it is a unicellular algae. So, diatom is a unicellular algae with a silica cell wall. So, it is an algae which is unicellular and it is having a silica cell wall. So, it is a silica cell wall. Now, what happens here is that this diatom, these are specific to each and every water body, every lake, every sea, every water body will have a specific species of this diatom. Now, the idea is that the diatom test, it is used to differentiate antemortem or post-mortem drowning. So, this is the idea behind doing this diatom test. So, how exactly the test is done is that, see, this is the diatom. This is how a diatom looks like. Do you see this? They will come in multiple shapes, and usually when you look under microscopy, only this transparent, this kind of white structure will be seen. So, what happens is that we will take bone or brain or liver, like mostly peripheral sample. We will be taken for analysis and we will put that sample in acid bath for 24 to 48 hours, especially sulfuric acid, some concentrated acid. We will put the tissues in and we will wait for the tissue to digest. Then we will take that fluid, then we will centrifuge, then we will make slide and look for the diatom. So, if diatom is present, it means it is a case of antemortem drowning. If diatom is absent, then it is a case of post-mortem drowning. So, this is how we usually do this diatom test. But what exactly is the idea? How this positive and negative we are saying, we will see now. So, what happens is that I already told you this diatom, it has this silica coating. So, this silica is very much resistant to acid. So, this is the reason why we choose diatom. So, this silica is very much resistant to acid. Now, I already told you the diatom is specific to each and every water body. Now, let us take a scenario. If a person is like undergoing an antemortem drowning, that is a person is alive, then he enters the water. So now what will happen? Because of that inhalation of water, along with the water, diatom will enter the lung. So water and diatom will enter the lung. If the person is alive, means respiration is alive, circulation is alive, right? So both are working, and because of this circulation from the lungs, the diatom will go to the heart. So circulation again, it is there because the person is alive, right? So from the heart it will go to periphery. So now if we take a tissue from periphery and if we look for the diatom, then diatom would be present in that individual. So diatom positive means it is a case of antemortem drowning, right? So we will take another scenario where the person is dead, means no circulation or respiration, both will be absent. So now the water plus diatom, it will still enter the lung. Because of this passive diffusion, it will still enter the lung. But the issue is that because there is no circulation, since the circulation is absent, this diatom from the lungs, it will not go to the heart or the periphery. So heart it will not enter, periphery also it will not enter. So this is how things happen. So lungs, if you take and examine lungs for diatom, still you will get positive diatom. But here in periphery, if you take and test, you will not get any positive diatom. So this is why we choose these peripheral organ like femur or brain. So if diatom is present even in the periphery, means circulation had present. Circulation present means the person was alive. So using this test, this is how we identify whether it is a case of antemortem drowning or postmortem drowning. So now the surest sign of postmortem antemortem drowning are cadaveric spasm, presence of vegetation and froth beyond bifurcation of trachea, and finally positive diatom test. So these are the important signs that will help us to know whether it is a case of antemortem drowning or postmortem drowning. So this is how we differentiate between these two. And apart from that, you have one more test, that is known as jetless test. So here what happens is that you will look for the chloride ion content in left side of the heart. If it is increased, then it is a case of seawater drawn. If it is reduced, then it is a case of freshwater drowning. So this is how you differentiate whether it is a case of seawater drowning and freshwater drowning. Apart from that, you can also differentiate these two by presence of what? If it is hemodilution, it is freshwater. If there is hyperkalemia, it is freshwater. If arrhythmia is the reason of death, then it is freshwater. If there is hemoconcentration and pulmonary edema, it is seawater drowning. If there is hypernatremia, it is seawater drowning. And in jetless test, chloride ion content will be increased in left heart in case of seawater drowning, reduced in left heart in case of freshwater drowning. So this is how you usually differentiate seawater drowning and freshwater drowning. And antemortem and postmortem drowning, how you differentiate? Presence of cadaveric spasm, presence of vegetations or any dirt beyond the bifurcation of trachea, especially in the terminal bronchiole, presence of froth beyond the bifurcation of trachea, then positive diatom test, especially from organs taken from the periphery like your femur or brain or liver. So these are the important things that we have to remember in case of drowning. So with this, we are ending this mechanical asphyxia topic. So mechanical asphyxia, till now we saw hanging, strangulation, suffocation and finally drowning. In the hanging, the most important thing we have to know is the definitions, and what are the types of hangings and what are the type of strangulation, and the most important question they will be asking you in hanging is the mechanism of death, then the internal and external findings, then about manual strangulations, what are the internal findings, what are the differences between hanging and strangulation they will be asking you, and drowning, types of drowning is important, pathophysiology of drowning is also important, and surest sign of antemortem drowning, that is very much important. So with this we are concluding this asphyxia topic. Thank you for watching.